So when you get to someone in their late 40s, 50s, and 60s, the breast will start to sag, the natural breast will start to sag, and you'll see some wrinkling right in their cleavage area. It's very simple to remove that and also to tighten the breasts and to raise them up. Our success rate has been about an inch raised from where it starts off with to an inch. Our success rate is about an inch of elevation of the nipples on a person's body. Let me see what I need to do. Oh, there's one other thing we'll do that after the fact. So let me show you a little bit about the technique. So there's two modalities that we can use with the breast lift, and this is only for the lifting. They're both the polar heads. One is the multipolar, this one here, which also has red LED light in it. And if you've got a person with a lot of skin area, you can use this one. If you've got someone with a small amount of skin area, you can use the tripolar. And the tripolar does the same type of technology, also has the red LED lights as the multipolar, but it's easier to work on a smaller person's body frame. So to start off, when you're using the multipolar or the tripolar, we're using oil. You can use many different types of oil. You can use avocado oil. We use grapeseed oil. We've had over 1,000 clients. We've had reactions to the grapeseed oil with 2 of those clients where they had an allergic reaction to the grapeseed oil. We caught it very early on, wiped it off, cleansed the skin, and it was not an issue. If you use avocado oil, I can't tell you exactly what the rate is of allergic reaction on the skin. So I'm going to use the grapeseed oil, and we're really looking at the top part of the breast. So when you take a look at it, you've got muscle fiber from here down to the top of the breast. And the other area that we'll want to do is below the breast, to tighten the breast up underneath. This technology will shorten the collagen fibers, and it will create a collagen blast around the collagen sac. Collagen is a protein inside your body that is the building block of your skin. And what we're trying to do is we're trying to trick the collagen into thinking that you're 10 to 20 years younger than you currently are. And what we do is, with the radio frequency, with the multipolar, this will shorten those collagen fibers up, which in turn tightens the skin. So I want to go to the multipolar. I'm not going to do a huge amount of energy. I would start at 5, 6, and at the most get up to about 10. And you're looking at doing about 12 minutes per breast. So you'll do about 7 minutes on the top, about 5 minutes on the bottom side of the breast, and you're going to be working in concentric circles. The bottom part of the breast, you're just going to be moving it back and forth.
There was like static when you said that.
Okay, I'll do it again. So you'll be working with a couple of different techniques with the head of the multipolar. So if you can take a look, you can see that there's red LED light in it. And what I'm doing now is just warming the tissue up. And you can do those concentric circles if you want. And there's no reason to be working on the nipple. You want to work from that point up, and then down below the breast, you want to be working underneath the breast. So this client has had implants, and you would never do this treatment on someone that's got implants. So what you're trying to do is, if the breast is saggy, you have to hold it up and work in that fashion to be able to get the treatment that you want and the results. Let me show you on this side. So I'd be going up and down the chest like here. And you can imagine the collagen fibers being shortened, which would tighten the skin all the way from here down to the middle of their breast. And you want to tighten all the skin up down below, just like this. I recommend working on one side and then the other. So I would clock 12 to 15 minutes per side, so anywhere between 12 and 15 minutes. Watch the tone of the skin. If it starts getting red bumps, turn the energy level down. We're only at about a 5 right now. If I go up to a 10, I would want to turn that energy level down if I see any redness showing up on her skin. Since she does have implants, I'm not going to be using actual energy on her. I'm just showing you the technique. And you can ask, well, what if somebody has implants but they're starting to get wrinkly between the two breasts? Yes, you can do that. And this is the technique I would use for tightening that skin up. And it would be part of a treatment that you would be using for the neck as well. And that's the technique that you want to use. You can go in straight lines. You can do the concentric circles. I like to count. If I do 10 there, and there's a reason why you want to count. If you keep going back and forth over the same area over and over again, you're putting a whole lot of energy and a whole lot of heat inside that tissue. It's going to become very uncomfortable, especially if you're working on a small area. You want to be able to go to one spot, let the other spot cool down, and I count to 10, and then I move to the next area. I can tell you that when I've had the treatments, if I'm getting more than a 10 count on a certain small area like this, I'm feeling a lot of heat and it's becoming very uncomfortable. And there's no reason for that. Do one breast for 10 to 12 minutes. When it shuts off, do another 10 to 12 minutes on the other breast, and you should be good to go. Now I'm going to wipe the skin off. And again, the oil will definitely stain clothes. What kind of towels do we use? These are microfiber, and we get about 3 to 4 months of use out of them before we throw them away. The oil and the lotion will turn them hard and not soft. So towels, just like your oil and your ultrasound lotion or gel, is a consumable. Just assume you're going to have to replace them. And there we go.